So Diane, you've outlined, there's a huge number of different services that you can provide for for all these patients with, the different mobility problems. There is one other service that I do have problems in pronouncing the service, so I'd appreciate if you could announce it, but if you could just overlie, what's involved in that.
So we also do splinting and orthotics here.
That's the word.
And that's and that can come into the orthopaedic or the neurological arena. But we work with both teams, probably mainly orthopaedic, because again, it's a fairly new emerging field, but it's looking at utilising orthotics for the management. It could be in conservatively managed patients where the owners want to avoid surgery where possible, or it can be something we implement post-surgery in managing cases post-surgery. So it can involve soft supports in the form of neoprene material supports. There's also splints, which are made up of thermoplastic materials, and this is something that we make bespoke for the patient. So it's a material that is softened down into hot bath, and we mould the splint to the patient's limb. So it's bespoke and made to measure. So we're trying to minimise pressure sores arising from the use of this type of material rather than something that's off the shelf. And I suppose my experience for this came from my human background, as I specialised in hand therapy in the human field. So I've had a lot of experience from my patients wearing these products and telling me where sores are arising or what feels comfortable, what doesn't feel comfortable. It's very difficult when you're dealing with small animals because they can't tell you when there's a pressure point. So I think having a high level of skill in this area is quite important if you are looking at doing this. And then there's the orthotics, which we might call grade 4 orthotics, but it's something that's more robust. It's something that you can obtain from a number of companies around the world, and we work with a few, but it involves casting the limb and taking an impression of the limb, which is then sent off to the companies that develop these products, and then they will have the limb shape which they can then make their orthotic that we require for post-op cases or conservatively managed cases. And these can be non-articulating orthotics, which means that they don't allow a joint to move, which can protect a healing structure or a surgically addressed structure. And then you can have articulating ones which allow the joint to move perhaps in one plane and protect other structures around the rest of that joint. And then there's the motion limiting orthotics that are also available, which allows us to gradually load a structure that's been repaired over a period of time, so you're not suddenly going from an immobile joint where there's no movement at that joint to a completely mobile joint. So we can do it in a much more gradual fashion. And yes, I get very excited when I talk about splinting orthotics because we can get some fantastic results, which will, can in some cases benefit patients which otherwise might have been surgical candidates.
Oh wow! So I mean, it's quite a potentially powerful intervention, but as you highlight that it's absolutely important that you have somebody who's experienced measuring and placing this, because otherwise you could create secondary problems that will make it more complicated. Absolutely.
And then you're left with a whole arena of complications, from pressure sores, etc. So you're having to manage those, and if those arise, then it means you have to remove the orthotic or certainly make some radical changes to address it if they have to be reliant on something like that. So it's with care and due diligence that you go down this field.
Cool.